Good afternoon, everybody, and thank you all for joining us today. We wanted to take this opportunity to provide a couple of updates on our COVID-19 response. As you know, last week we identified the first case of the Omicron variant right here in Wisconsin. I know that many are concerned, and I share that concern, but I want to stress that this is not a cause for panic. We're still learning more about this new variant every day, but Delta remains the dominant variant in the state of Wisconsin. So our strategies haven't changed. Now is the time to double down on our efforts to stop the spread of COVID-19, including this new variant, the Delta variant, and any other variant that might come along. We have the tools to do that. Wearing our mask in accordance with the best public health guidance, especially when indoors and in crowds, and getting vaccinated. The COVID-19 vaccines are safe, effective, and the best tool we have to keep ourselves, our loved ones, and our communities healthy and safe, period. All 72 counties in Wisconsin are experiencing high community transmission. Counties are seeing record COVID-19 hospitalizations for the year, and many of our healthcare systems, from our largest to our smallest, are reaching capacity. And folks, that's concerning for a few reasons. First, our healthcare workers have been on the front lines of this pandemic since day one. They put their health and safety on the line to treat our loved ones, and just as we have throughout the pandemic, we need to be doing everything we can to help support them, lighten their burden, and ensure that they can stay healthy and safe to do their jobs. And as they've reminded us before, there is no secondary line. Our state and nation were facing a health worker shortage long before this pandemic hit. And when our facilities are at capacity, it means our healthcare providers are stretched thin. And if you think this doesn't impact you, you'd be wrong. According to the Hospital Association, only 37 of the state's 1,331 ICU beds were available as of yesterday. When our beds are full of COVID-19 patients and our healthcare providers are stretched thin, hospitals have to go on diversion, turning away patients who need care and causing folks to travel miles from home for care. But again, we have the tools to support our healthcare providers, to lighten this burden and help open up bed capacity that's getting vaccinated. By the end of this briefing today, I'm going to sound like a broken record, but the science is clear. According to DHS, those who are unvaccinated are 5 times more likely to be infected, 11 times more likely to be hospitalized, and 15 times more likely to die from COVID-19. Getting vaccinated is also the key to ensuring our statewide economic recovery, make sure that continues. From our small businesses to our workers to controlling rising costs, all of this depends on our ability to put this pandemic behind us once and for all. Wisconsin is bouncing back, and we're doing what we can with our federal coronavirus relief funds to ensure this bounce back continues. Over the course of this pandemic, we've committed $1 billion in grants and direct support to farmers, small businesses, industries, and main streets in our communities, which has helped thousands of businesses, folks, and families across our state. This work continues even today. This week, we distributed $14 million to entertainment and tourism businesses across our state, including 49 movie theaters, 17 minor league sports teams, and 37 summer camps. And we've directed more than $200 million to our local communities to help them address their unique needs, from addressing the ongoing public health impacts of the pandemic, to investing in needed critical infrastructure, to helping ensure families and businesses financially recover. These funds will make a big difference for Wisconsinites across our state. We also announced last week a $110 million investment in our kids and our schools. Our kids in schools have faced unprecedented challenges during the coronavirus pandemic, from distance learning to reducing class sizes to spending money that has been budgeted for pencils, doing it on PPE. This $110 million investment is an opportunity for schools to invest directly into programming to help students both in and out of the classroom, allowing schools to hire additional educators and staff, provide more educational and extracurricular opportunities, invest in those important mental health supports, buying art supplies or computers or keeping the lights on, whatever they need, and most importantly, whatever our kids need. But here's the bottom line. We must do everything we can to support our kids in schools if we want the economy to recover, that recovery to continue. So if you're worried about our kids' recovery, if you're worried about our economy, if you're worried about rising costs and where our economy is headed, get vaccinated. I know this has been a long road. It's been 19 months since we first declared a public health emergency in our state. It's been nearly years since the first vaccines came to our state. And I know we are all tired and experiencing COVID-19 fatigue, but we cannot give up now. But thank you all to the more than 3 million Wisconsinites who have gotten vaccinated, to the nearly 100,000 kids between the age of 5 and 11 who have gotten vaccinated, and to all those who have made appointments to do so. And if you're eligible for a booster, get your booster. More than 1 million booster and additional doses have been administered here in Wisconsin, including my own booster. Everyone ages 18 and older should get a booster shot 6 months after their initial Pfizer or Moderna vaccine series, or 2 months after their initial Johnson & Johnson vaccine. So don't wait. As we learn more about this variant and how easily it spreads, it's crucial that all Wisconsinites continue to practice good public health safety measures. Head to vaccines.gov and find your booster or vaccine appointment. Wear a mask in public indoor settings. Stay home if you're sick, and get tested if you're experiencing symptoms or have been exposed. Especially as we head into the holiday season, taking these precautions is going to be critical to ensuring we can all celebrate safely with our loved ones. So with that, I am wishing you all a healthy and safe holiday season, and I'll now turn things over to DHS Secretary Karen Timberlake. Karen?
Good afternoon. Thank you, Governor, and thank you all for joining us today. With cases rising and the detection of the Omicron variant in Wisconsin on December 4th, we're asking all Wisconsinites to stay vigilant in their efforts to stay healthy and to help prevent further strain on our hospitals and our healthcare providers. As of today, 59.2% of Wisconsinites have at least one dose of the COVID-19 vaccine, and 56.3% have completed their vaccine series. Additionally, Wisconsin vaccinators have administered 1,182,409 booster and additional doses of the COVID-19 vaccine. Today, however, we are reporting 3,519 new confirmed cases of COVID-19, bringing our 7-day average of new confirmed cases to 3,155. We are sad to report 33 more Wisconsinites have died of COVID-19. Our thoughts continue to go out to every family who has lost a loved one to this disease. We have not seen this level of disease activity since December of 2020. Statewide, 97% of intensive care beds and 98% of intermediate care beds are currently in use in hospitals across our state. As of December 7th, there are 1,630 Wisconsinites hospitalized with COVID-19, and that is an increase of 212 patients in just 1 week. 418 of these patients are in the intensive care unit. Given this situation, together with Governor Evers, all of us at DHS remain committed to supporting our hospitals, nursing homes, and other care providers. DHS established a staffing contract in October to assist healthcare facilities in filling critical gaps that are affecting the capacity of hospitals, nursing homes, and assisted living facilities to deliver care to people who need it. We currently have over 360 nurses, certified nursing assistants, and other personnel providing support to patients and residents of more than 65 hospitals and long-term care providers across the state under this contract. A total of more than 270 hospitals and long-term care facilities have requested staffing support, and we are actively working to connect them with staffing agencies. $19 million in American Rescue Plan Act funding has been invested to support this effort so far. And we will continue to take full advantage of other resources that are available to us from the federal government. We are working with Wisconsin's Department of Military Affairs and Wisconsin Emergency Management and Wisconsin's hospitals to request medical reserve teams from FEMA. These teams will be dispersed around the state and will add important capacity, especially in intensive care units. We will be using an additional $11.5 million in CDC funds to assist long-term care facilities in training more certified nursing assistants and further strengthening infection prevention measures to continue to reduce the risk of COVID-19 transmission in these facilities. The bottom line is that we will continue to make every effort to make sure our hospitals, nursing homes, and assisted living providers have what they need to care for all of us. In order to do this successfully, we must prevent further strain on Wisconsin's health and long-term care providers, and we cannot do this without you. That's why we're asking all Wisconsinites to help by taking the following steps. As the governor said, get vaccinated against COVID-19 and the flu. Get your booster shot if you're eligible. Stay home if you're feeling sick. Wash your hands frequently. If you're experiencing COVID symptoms or have been identified as a close contact, please get tested for COVID-19. And finally, we are urging all Wisconsinites to wear a mask in public indoor settings. By doing what we can, together we will help slow the spread of COVID-19, including the new Omicron variant. Thank you.
Thank you, and we'll now take your questions. A reminder to keep your phones muted until it is time to ask your question, and that's *6 will mute and unmute your phone. Also, as we have to be out right at 2 o'clock today, please only one question per reporter. And we'll begin this afternoon with Ben Boken from NBC 26 in Green Bay. Ben?
Hi, yes. My question is pretty simple. It's really just when that number of hospital beds or ICU beds reaches zero, you know, what's going to be done, or what does that really mean for the community?
So the good news is that we are doing everything that we possibly can to prevent that from happening. The reality of it is that we have very tight hospital capacity today, as you're hearing not only from us, but also from hospital leaders all over the state. That said, this is fundamentally a staffing challenge, as our health system leaders have been telling us. And so by taking the steps that we've outlined, the staffing contract, expanding CNA training, bringing in additional federal resources, we will do everything we can to prevent a situation where we have no hospital capacity. That said, we are already at a place in some parts of our state where there are few to no ICU beds available in particular. And that's why we need everyone to continue to participate with us in doing what we can to prevent this situation from getting any worse.
Thank you, Ben. Now to David Wahlberg from the Wisconsin State Journal.
Yeah, thank you. I guess I'll ask a data question. Secretary Timberlake, you gave the latest figures for cases and deaths, but the website hasn't been updated for a few days. Will those new figures appear today, and will some of the data from recent days show up?
It sure will. We had an upgrade to our disease surveillance system over the weekend, and we've had numbers of cases that have been essentially waiting in a queue that need to be pushed through into the data system and out to the website. So we will get all of that data updated just as fast as we can.
Thank you. Now to Will.
Hi there. Thank you. I am wondering, my understanding is the decision earlier this year that the state's hands are kind of tied in terms of implementing statewide restrictions. But I'm wondering if you Secretary Timberlake or Governor Evers or whoever would like to answer this, would renew or pass new restrictions like local mask mandates. I believe the only current local mask mandate in the state is in Dane County. Would you encourage other local governments?
I'll take that. The Supreme Court made it very clear that our ability to do statewide mandates is no longer an option. So the most important option that is out there at this point in time is getting a shot. People can wear masks voluntarily. It is easy to do. It happens all across the state. But the fact of the matter is people should get vaccinated, period.
Thank you, Governor. Now to Scott Bauer from the Associated Press. Scott?
Thanks again for doing the call. We were talking, your health officials last spring were talking about potentially being at herd immunity, 80% vaccinated by June for the adult population. Does 80% remain? Think that we'll ever get to 80%? And given that the numbers have kind of stalled, is there any new strategy being thought about to try to get those numbers higher?
Do you want to talk herd immunity?
Sure. So the proof that really no communities in our area, in our country, our continent are near herd immunity the cases are still tremendously high and increasing in many areas. So the number at which immune protection at the community level will really stop transmission is still to be determined, but we're far from it. Even states in the U.S., particularly in the Northeast, that have vaccination rates higher than Wisconsin are experiencing surges. So we don't speak of herd immunity as a magic number where COVID will go away. We need to all do all the little things in combination. There's not going to be a threshold where we reach where this stops to be a problem. We're going to have to continue to ramp up our efforts using multiple strategies, vaccination being number one, masks being extremely important and increasingly so. Now the activities are moving indoors to try to prevent as many cases as we can. But there's not a finish line in sight where COVID is going to go away when we reach some threshold. We're going to have to work very hard in a concerted way using multiple tools to try to minimize transmission as much as we can. Masks and vaccines and keeping gatherings small are key steps for that in the coming months.
The other thing to add is we continue to vaccinate thousands of people every single day. And what we know is that we have groups across our state, particularly 65 and older, where we have met and even exceeded that 80% target that we originally set out. And we are seeing the benefits of that in reduced cases, reduced hospitalizations, and reduced deaths for older adults in particular. So we need to stay the course, just as Dr. Westergaard noted, and continue to do what we know will work to put this pandemic behind us.
Thank you. Now on to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for having this call. I'm wondering if you could talk about how many people would be in these FEMA teams and how many FEMA teams that ideally we would receive, and whether anyone is considering mobilizing the National Guard to help with hospital staffing. Thank you.
Sure. So at the moment, we're looking at regional FEMA teams, as many as 5, although we also know from our sister states who are also working on similar strategies that obviously FEMA resources have some limits to them as well. So what we need to do is ask for what we think is in the best interest of the people of our state, and then work obviously with federal partners to make sure that we can get what we need across our state. We understand that there may be in the neighborhood of about 20 staff per FEMA team. And so as noted, the real strategy here is to use those staff strategically to make sure that we can free up capacity in our ICUs. In terms of our National Guard, we've had just a tremendous partnership with the National Guard since the very beginning of the pandemic. We continue to rely on Guard teams to help with some vaccination clinics, even some testing in schools and community settings across the state. We are certainly accessing National Guard nurses and CNAs to provide some support in state facilities and continuing to look at how we can make the best use of these wonderful volunteers.
Thank you. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks for this call. Governor Evers, you mentioned that this has been a long road and it has been along the lines of 19 months since all this began. What is your message, and this is open to anyone, what is your message to the people who simply say they're not going to do it anymore? They're done with masks. They're done with booster shots. They've been living their lives as they did before the pandemic, and who don't believe that this is ever going to truly go away. I mean, I'm not talking about people who are demoralized here necessarily, or people who are anti-vaxxers or ideologically opposed. I'm talking to people who have decided to return to their normal lives and are going to continue to do so. What is your message for them? Thank you.
Yeah, and for the most part, returning to their former lives can work. We're talking about encouraging people when they're indoors to mask up, keep the socially distanced, or be with people that they know are vaccinated. And so I get it. We've already returned to a relatively normal life already. That said, if we truly care about our neighbors, and the fact that our hospitals in the Green Bay area is a good example, are reaching their limit and have no place to go for sick people, then it's time to do the right thing, and that is to be vaccinated. There's no reason why that can't happen. I would encourage local representatives in the, we're talking about what can the state do. Well, I can tell you what it would be great if our state representatives decided to do it. It'd be great if they're in Madison, but they should be encouraging the local people to get vaccinated. They are leaders. People do listen to them, whether they're Republicans or Democrats. Having a legislator get on the media, talk about the importance of vaccines. We just can't let our hospitals go into crisis mode here, folks. And we need everybody to do that encouraging. People can change their mind. I know there's lots of people that are against vaccines out there, but people can change their minds, and I think if we all get together and encourage people to be vaccinated, I think we can make a difference.
Thank you. Now to Alex Moe from wistbusiness.com. Alex?
Thank you. My question is for Governor Evers. With new variants like the Omicron variant popping up and posing somewhat of an unknown threat, how do you plan to use the resources at your disposal to combat them? Are you considering anything like a paid media campaign or public service announcement or anything else aside from the standard public health approach that's been spearheaded by the Department of Health Services? Thank you.
Yeah, and we'll do whatever we can. Well, if it's something different than the public health angle, we'll do whatever we can. This is an important thing to do. So we're exploring other things, to be frank. But if we can't convince people to get vaccinated because of public health reasons, and we've already we gave away money for people to be vaccinated. We'll have to be more creative going forward. But at the end of the day, it is up to individuals to make that decision, and I think whatever we can do to encourage that, via the media, via state lawmakers, whatever it is, we're going to try to do it.
Thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
I have a technical question about specifically the Johnson & Johnson vaccine. Today we got word that people with a booster shot from the Pfizer and Moderna vaccines appear to be better protected from the Omicron variant than people without the booster shot. And I'm wondering where that leaves people with the Johnson & Johnson vaccine, which consisted just of one rather than 2 or 3 shots. Also, whether because the booster of the Johnson & Johnson is after 2 months, whether Johnson & Johnson vaccine recipients are going to have to be getting boosters every 2 months. Thank you.
I'd be happy to take that one. Yeah, you're right. You picked on a couple of good points from the recommendations related to boosters. The first is that if people got Moderna or Pfizer vaccine for their primary series, the 2-dose primary series, they are recommended to get a booster shot 6 months later. And if someone received the Johnson & Johnson vaccine, which is a 1-shot primary series, they are recommended to get a booster shot 2 months after the initial vaccine series. So the CDC and their advisory committee looked at all the data and are encouraging people to use the vaccine that's available to them and allowing people to mix and match. So if someone received the Johnson & Johnson vaccine for the primary series, they can get and may choose to get the Pfizer and Moderna vaccine. The data showing that one vaccine regimen is superior to the other are still emerging. There's no recommendation that someone should do a certain mixture versus another. The most important thing, I think the recommendation that should be the leading recommendation is that people should get a booster as soon as possible if they're eligible, because we want to get people protected as soon as possible in this environment where the virus is spreading so quickly. So don't wait. I would minimize the idea of picking and choosing vaccines. Get a booster of any of the available authorized vaccines, and that will be correlated with strong protection, particularly among hospitalization and death.
Thank you. Now on to Elizabeth Wattis from NBC 15 in Madison. Elizabeth.
Hi, everyone. Thanks so much for taking my question. My question has to do with the ICU bed, just kind of makeup of patients you're seeing. Last week, a representative from UW Health told us that while COVID cases are rising, less than 10% of inpatient volume is from COVID-19 patients. So just how many COVID-19 patients are taking up these ICU beds? And also, we haven't really heard much about the flu this year. Are cases mild? Are people coming to the hospital with the flu as well? Just trying to get a better picture of, what these patients are being treated for in these ICU beds.
I'm happy to start, and then I'm sure Dr. Westergaard would like to add on as well. So again, today we have over 400 patients around our state in ICU beds with COVID-19. The fact that those numbers may be a bit lower at one hospital or another, particularly here in Dane County, may be attributable in part to higher vaccination rates here in Dane County than in other parts of the state. I think as you've seen other health system leaders, though, just in the last day to week, comment on what they're seeing in their hospitals, they are seeing very high numbers of patients with COVID-19, and those patients are overwhelmingly unvaccinated in terms of who is ending up in our hospitals and in our ICU beds with COVID-19. In terms of flu, certainly Dr. Westergaard will have more to say on this. I think the thing to say at the moment is we are watching this extremely carefully. The flu does cause numbers of hospitalizations and deaths every year. And as you're hearing all of us emphasize, we don't have any more capacity for that next wave of a contagious illness, particularly one like the flu that can be pretty well prevented with vaccination. So we're watching flu numbers carefully. We really do strongly encourage everyone to get a flu shot when you get your COVID-19 vaccine or your COVID-19 booster. You can get them at the same time. And again, going to vaccines.gov or calling 211 will help point you in the right direction. But Dr. Westergaard, what would you add about flu?
Yeah, thank you for bringing the topic up. A few really important points about influenza. The first is that, the last flu season, 2019-2020, we saw very, very little. That was good because our hospitals were strained this time last year. So we're not going to see the same absence of an influenza season. We are now starting to see flu activity at a low level, but it has been increasing over the past 2 weeks, and we've seen outbreaks or clusters among young, healthy people, including some residents of college campuses. So this is important for a couple of reasons. The first is that when we track our influenza vaccination numbers, we're a little bit behind where we were last year. So Wisconsin residents need to go out and get their flu vaccine if they haven't already, because as Secretary Timberlake says, we don't have capacity to treat a large number of people who are sick and require hospitalization with influenza. The other thing is that we're seeing a strain of the influenza vaccine, the H3N2, which can be associated with more severe disease. So it's early in the season. We're not seeing large numbers of influenza hospitalizations, but we know that it is circulating. The same activities to prevent COVID can also prevent flu, but the vaccine are specific. So we need to get COVID vaccines, COVID vaccine boosters, and our annual flu shot to have optimal protection. And then all of the other prevention strategies, wearing masks, aren't generally recommended specifically during flu season, but they work the same way. These are viruses that spread in respiratory droplets and coughs and sneezing. So another reason to mask up when we're indoors, to stay home when you're sick, to get tested if you get symptoms, and stay home. So thanks for bringing that up. It's just another element that we need to watch very closely in the coming months to protect our hospitals and our healthcare professionals.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. We're wondering, thank you for any updates on whether there have been more cases of the Omicron variant in the state. Thank you.
Sean, you may have to repeat your question. It was hard to hear you.
My apologies. Just wondering, are there any more cases of the Omicron variant in the state past the one that was reported Saturday? Thank you.
Yes, talking with our laboratory partners, we have 5 high complexity laboratories in the state that do whole genome sequencing on SARS-CoV-2 positive specimens, and there's also national labs that do this genomic surveillance for CDC. As of this morning, I've heard about 3 additional confirmed Omicron cases. We are in the process of investigating all of these cases to notify people who are exposed. We're using the same contact tracing skills that we've developed over the past 2 years at the local level to reach out to these cases. Not all of the cases are going to be people who had travel history, so that implications of that are that there's a low level of the Omicron variant spreading in communities in Wisconsin. But the important point that I think we mentioned earlier is that greater than 99% of the virus circulating is the Delta variant, which we know well can cause very severe disease, which we know can be protected against with vaccination. And so our general strategy hasn't changed. Our recommendations are the same. It's important for people to be aware that there's a new, possibly more transmissible variant that is emerging, but we're really in the early stages where we're learning what the implications of that. We still need to answer the questions about disease severity, about any potential reductions in vaccine efficacy. Those will all be determined coming. Right now, the epidemic we have is one caused by Delta, and we are in the process of learning about a new genetic variant in real time.
Thank you. Now to Emily Davies from WSAW-TV in Wausau. Emily?
Hi, thank you for taking my question. I have kind of a two-parter. So one is related to the hospital staffing across the state. With the extra people that you're putting in, how many people are we still short? How many people do we really need to be able to fill those holes just to get the ICUs down? And then quickly related to the data, I know that we've all been waiting for that under 12 group who can get vaccinated. Do we have any information about how many of those children have been vaccinated and how that's been welcomed?
Yep, absolutely. So in terms of overall staffing capacity, the best way I can answer that question is to tell you that we have heard from hundreds of both hospitals as well as long-term care providers They are all doing what they can to stretch and flux and rebalance their own staffing so that they can meet needs all day, every day, with the addition, in some cases, of the supplemental staff that we are able to provide. So we are continuing to do what we can to match the staff that are available through the staffing contracts to the hospital and long-term care needs that are out there. In terms of the 5 to 11-year-olds, we are at almost 100,000 of those kids who have been vaccinated, so almost 20% of the way through. And we just began doing that work around a month ago. So we're really excited about the take-up of vaccination for our 5 to 11-year-old kids. It's also really important to emphasize that as we've been watching case counts go up throughout the fall, we certainly have seen a particularly sharp increase in those unvaccinated children. And while we know that COVID does not tend to make younger children as sick as it does older adults, we also know that they can get sick, they can end up in the hospital, and they certainly can transmit COVID to their family members and others in their community, and they can miss school and other really important activities. So that's why it's really important for parents and caretakers to go ahead and get those kids vaccinated. Call your pediatrician, call your care provider, get your questions answered, but do get your 5 to 11-year-olds vaccinated.
Thank you, Emily. Now to Shamane Mills from Wisconsin Public Radio. Shamane?
Hi, thanks for the call. I'm wondering what role misinformation continues to play in vaccine uptake, and whether you are aware of any Wisconsin medical professionals contributing to misinformation about the vaccine or the pandemic in general.
I think one way to think about this is it's really natural for people to have questions about something that's new. You know, none of us had heard of COVID-19 or SARS-CoV-2 before 20 months ago or so, as the governor noted. And a lot of us have forgotten anything we ever learned in our high school science classes. So really very understandable that people have questions about COVID, about vaccines, about vaccine effectiveness. We also know that we are living through a time where there is so much information readily available to people. And so there is no question, just as the Surgeon General has called out, that misinformation about COVID vaccines is certainly spreading across the internet and in friend and family conversations. So there are a couple simple steps people can take to help combat that misinformation. One of the ways we can combat it is by doing what you all are doing today, by participating in a briefing with people who are studying the facts and the science and the data and sharing straightforward information. Another thing we all can do when we're tempted to grab that headline and share a story in our social media or with our friends and family is to pause, check the source, look and see if it's a reputable organization, and really be willing to delay a little bit before you share something that seems sensational.
Thank you. Now to Jack Kelly from the Cap Times. Jack? A reminder, *6 unmutes your phone. Jack Kelly from the Cap Times in Madison. Jack?
Hi, all. Thanks for doing this. I wanted to ask about schools. I know earlier in the fall, Secretary Timberlake had said that we aren't seeing a lot of community transmission in schools, and we're seeing more of our kids are getting infected at home or elsewhere in the community. Is that holding true as we are in this period of more disease activity as the weather gets colder, kids aren't going out for recess as often? What's going on with schools right now?
It's certainly the case that we are seeing rising cases among school-age kids, and it is hard, I think, to pin that down to the precise setting in some cases where those kids may have gotten infected. We know that numbers of schools around our state have been doing the right thing, making sure kids are continuing to wear masks, doing what they can to really keep kids safe and have them involved in as normal a school experience as possible. And we also know of places where that is not happening, and we have had more schools that have had to be closed or close classrooms. The CDC, I know, put out some really good research earlier in the fall showing how effective mask wearing really is in school settings. So really applaud those schools and those parents that are taking those steps to keep their kids safe in addition to vaccinations. But Dr. Westergaard, I don't know if you'd add anything to that.
I think the other tool is testing. The more we've been able to do of getting testing in school, testing with children with symptoms, family members who are exposed, we've been able to interrupt transmission that occurs in communities. So those are two very important facts. One is that the growth of cases is highest among children of school age. The other fact is that the science has now been very clear and continues to get stronger that we know how to prevent transmission in schools themselves with masks primarily, social distancing, ventilation, and it remains critical that all schools use these layers to the greatest extent possible. So masks on every student, every staff person is going to make schools safer for everybody during this season when respiratory viruses are circulating. So we have tools we need to prevent transmission in schools, and we need to use them as much as we can.
Thank you. Now to Brett Lemoine from Fox 6 in Milwaukee. Brett.
Hi, good afternoon. In terms of the current surge in hospitalizations with COVID, what specific demographic are you seeing, and how much of this surge can be blamed on Omicron?
Yep, so the demographic trends are essentially that we are seeing patients in the hospital who are younger than was the case at this time last year, and they are staying in the hospital longer. So they, in part because they are younger, they are healthier and able to hang on a bit longer. And on the flip side, what our hospital partners tell us is that the Delta variant in particular is making people sicker than what we had seen. So we definitely are seeing more use of ICU beds, more use of ventilators, and just more longer hospital stays in the current groups of people. I think it would be safe to say that little to none of the current surge that we are experiencing in hospitalizations is related to the Omicron variant, given that we are just beginning to detect it in the state. And again, the name of the game right now is continuing to combat the Delta variant by getting vaccinated and wearing a mask and getting tested, as we've been saying.
Thank you. Now to Joshua Pogoro from WBAY TV in Green Bay. Josh?
Thank you so much for taking my phone call. I appreciate it. My question is directed to the governor and even Secretary Timberlake. I know I spoke with providers of long-term care facilities, and one thing they talk about is just a severe staffing shortage, but they point to a more systemic problem, right? And that problem is managed care organizations and the funding that they get from these managed care organizations, which prevent them from paying people an adequate salary in order to retain them. I mean, what do you say to some of these providers who just think that, you know, the issues that they're having now with the pandemic has just been exacerbated, but this is more systemic. This comes from an issue with the way the vulnerable are treated in the state of Wisconsin. Thank you.
I'm happy to start and then obviously welcome the governor to add on. So the governor in particular has really been a champion of our direct care workforce throughout his time in office. We have had numbers of initiatives in governor's budgets to increase reimbursement for our direct caregivers. We have a substantial rate increase that will be going into effect thanks to both a leadership by the governor and some support from the legislature for nursing homes in particular. We have applied and are in the process of applied for and are in the process of distributing a 5% rate increase on top of some of those additional resources for home and community-based long-term care providers, because we know that a great number of Wisconsinites with long-term care support needs are living in communities and not needing institutional care. So there's no question that we need to make sure we have adequate resources for these direct caregivers and the work that they do, and we will continue to do everything we can to support those efforts.
Yeah. Secretary Timberlake hit the nail on the head. It is important to recognize that the people that are working in these institutions, hospitals, long-term care, and so on, are saving lives and every single day, and frankly, we can't do that on the cheap, and so we have tried to increase the resources going to employers in the healthcare industry to make sure that they're able to compete. But you can also see already that, and I've seen national stories, I haven't seen a Wisconsin story on this yet, of people leaving the employ of a hospital system or a nursing home and signing on to a private company that sends people all across the country and actually get paid a hell of a lot more than they do locally. So it's critically important to stay competitive, just as in any industry. And so we're doing our best to provide the resources to the hospitals and to the nursing facilities across the state. But it is an issue, and it's something that has been left in a problem situation for many, many years. I started one of my careers as a nurse's assistant when I was in college, and I was paid 98 cents an hour, and that was a long time ago, I know that, but I can guarantee you most people in the workforce back then were making more than 98 cents an hour.
Thank you. Now to Uba Ali from TMJ4 in Milwaukee. Uba?
Hello, thank you guys for taking my question. My question has a lot to do with, we've seen several incentives pop up across the state. What more can the state do to encourage more people to get vaccinated? I know you guys touched on how it's a personal decision, but you've really tried to encourage more people to do so with those incentives. Does the messaging change as we head into the new year?
Part of what we're seeing is more and more vaccinator partners step up. So we're seeing employers reach out and ask to set up vaccination clinics. We're seeing lots of schools that are wanting to offer vaccination, not just to kids, but also parents and caregivers. I visited a school-based clinic in Oshkosh a couple of weeks ago that was taking exactly that strategy. And so I think as we see more and more people getting in the game and making it easier and easier for people to get vaccinated, we're just going to see more and more shots being given. We also are continuing to partner with numbers of community-based organizations, Boys and Girls Clubs, and other kinds of nonprofits across our state that really can be those frontline, on-the-ground messengers, distributing, T-shirts and holding events and other strategies to really promote vaccination, make it fun, make it easy, make it available for people.
Thank you. Now to Isaac Deinson from WAOW TV in Wausau. Isaac?
Hello, thanks for taking my question. I just have a quick question about the availability of booster shots in the state of Wisconsin. Is there going to be any changes made to how they'll be available in regards to whether or not you'll need an appointment at all locations, things like that? What's the state of booster shots in that regard in the state right now?
Yep. Great question. COVID vaccines, including booster shots, are widely available across our state, and I really would encourage people to go to vaccines.gov or call 211, and you'll see all the many options. The answer to do you need an appointment versus can you walk in is that it varies. There certainly are places where appointments are preferred. There also are places where I saw a mayor's office not too long ago that's offering a walk-in vaccination clinic for people in the local community. So it's really a variety of strategies. So I think step one is really to check out the best source of comprehensive information, and that's vaccines.gov or 211.
Thank you. Down to Allison Bruner from Spectrum News. Allison?
Thank you. Briefings. When we look at the Wisconsin Hospital Association breakdown of the ICU bed shortage across the state, do you know how many of the beds are unavailable because there's no staff to run them? Also, how soon will we see the additional staff you mentioned today start working in Wisconsin hospital systems? Thank you.
Yep, sir. I believe our hospital partners would tell you that in many, many cases, beds that can't be opened up because of staffing shortages. So again, our hospital partners are definitely stretching and being creative in every way they can to create as much capacity as they can to care for people, not just with COVID, but also, people who need hospital care for all kinds of other reasons. And as the governor alluded to, that's what's so important about this moment that we're in right now, is that we all understand that the actions that we take to keep ourselves safe from COVID can help not only protect us, but they also protect our friends, our neighbors, our family members in the event that they need hospital care as well. In terms of when we may see the federal staffing teams arrive in the state, that's obviously something we'll work on as quickly as we can with our federal partners, and it will be determined in, I'm sure, no small part by the availability of staff, since, again, COVID continues to be a challenge around the country, and we all are needing to do what we can to control the disease in all of our states, because there is not a limitless supply of people to come and do this work. So we'll work as fast as we can, but we are limited by other factors.
Thank you. Our next question belongs to Matt Smith from WISN TV in Milwaukee. Matt?
Hi, thank you. Secretary, just following up on that with the FEMA personnel, I mean, are we talking days, weeks, months here? And Governor, to that, why hasn't the National Guard or alternative care sites been open, like, for example, we've seen in Minnesota?
We expect that we will have some response very quickly from our federal partners, and I would expect that we are talking about a matter of weeks, not months, before those resources will be available to us. And again, we've also got 360 or so supplemental staff that we as a state have helped with our hospital and our long-term care partners to position in hospitals and long-term care settings all across our state over the last 8 weeks.
Yeah, and right now the National Guard has been stretched, and I have no plans to immediately call out any National Guard men and women to do this work. It's best handled through the system that the Secretary just talked about. That said, we still do have many National Guards folks working under federal Title 32 in some of our state institutions, and that will continue. Those folks are mainly volunteers, or almost all volunteers. So we'll continue to monitor it, but we believe the options that the Secretary has put in place are better options for us at this point in time.
Thank you. And our final question this afternoon belongs to Frank Healy from CBS 58 in Milwaukee. Frank? Again, Frank Healy from CBS 58 in Milwaukee. And *6 unmutes your phone. Okay, looks like Frank can't join us, so that will conclude today's briefing. We thank Governor Evers, Secretary-Designate Karen Timberlake, Dr. Ryan Westergaard, and Ryan Mills for joining us today. Please continue to follow the DHS COVID-19 web pages for the latest information and guidance, and be safe and have a good afternoon.